Let's talk about something a lot of people are curious about but rarely get straight answers on: how to have anal sex safely. No shame, no clinical coldness, just the facts you need to protect your body, communicate with a partner, and actually enjoy the experience instead of gritting through it. This applies whether you're doing this solo, with a partner of any gender, for the first time, or the 50th. The anatomy and safety principles don't change based on who's involved. We'll cover 5 things: anatomy basics, hygiene and prep, lubrication, technique and pacing, and protection against STIs. Let's get into it. Here's the most important fact of the whole episode: the anus and rectum do not self-lubricate the way a vagina does. There's no natural wetness response back there. That single fact is the root of almost every safety rule we're about to cover. Second key fact: the rectum is lined with a much thinner, more delicate layer of tissue than the vagina. That tissue is called mucosa, and it tears more easily. Small tears, called fissures, are common, and they're exactly how infections, including HIV and other STIs, can enter the bloodstream more efficiently than through other kinds of sex. This isn't meant to scare you off. It's meant to explain why lubrication and slow pacing aren't optional extras. They're the core safety mechanism. Third, there are 2 muscles involved: an internal and an external sphincter. The external one you can consciously relax. Think Kegel in reverse. The internal one is involuntary. It relaxes on its own, but only with time, patience, and a body that isn't tense or in pain. You cannot force this muscle to relax faster. Trying to rush it is the single biggest cause of pain, tearing, and bad experiences. Finally, the rectum curves. It's not a straight tube. That's why angle matters more than force, and why a slow, communicative approach beats an aggressive one every time. Good anal sex is planned, not improvised in the moment. Before anything happens, have an actual conversation. Not a big formal sit-down, just clear, direct communication. What are we comfortable trying? What's a hard no? What's our safe word or signal to stop immediately? Have either of us been tested recently, and for what? Are we using protection, and what kind? If a partner brushes off this conversation or makes you feel weird for wanting it, that's useful information about whether you should be doing this with them at all. Consent here isn't a one-time checkbox either. It's ongoing. Anyone involved can pause or stop at any point for any reason without needing to justify it. If that's not something your partner respects, the technique advice in this episode won't save you from a bad experience. You don't need an elaborate ritual, but a few basics matter. Timing. Many people find it easier to plan around their digestive schedule. For instance, a bowel movement an hour or 2 beforehand, followed by a normal shower, is usually enough for most people. External cleaning is enough for most people. A warm shower and washing the outside of the anus with mild soap and water covers the large majority of situations. You do not need to douche or use an enema every time. And this matters medically. Frequent douching or enemas can actually strip the protective mucus lining of the rectum, making tissue more fragile and more prone to tearing and infection, not less. If you choose to use an enema occasionally, plain warm water, used gently and infrequently, is safer than commercial douche products, which often contain irritating chemicals. Trim nails, remove sharp jewelry. Obvious but often skipped, and a real source of small injuries. And empty your bladder beforehand. General comfort tip, not a safety issue, but it helps you relax. If you remember one thing from this whole script, make it this part. Because there's no natural lubrication back there, you need more lubricant than you think, applied more often than you think. Most people underestimate this dramatically. Reapply during the act, not just at the start. The type of lube matters, and it depends on what you're using. Water-based lube is safe with condoms and all toy materials. Easy to clean up, but it dries out faster and needs reapplication. Silicone-based lube lasts much longer, which makes it great for anal specifically. But it degrades silicone sex toys over time, so don't pair the two. Oil-based lube, including things like coconut oil or Vaseline, should never be used with latex condoms. Oil breaks down latex within minutes and causes silent condom failure. If you're using oil-based lube, you'd need a non-latex condom, like polyurethane, or skip the condom question entirely and rely on other protection strategies. Avoid anything with warming, tingling, or heavy fragrance for anal use. The mucosa is sensitive, and these often cause irritation or micro tears you won't feel until later. A thick, long-lasting lube. Many people like a silicone-water hybrid for exactly this reason. Applied generously to both the entry point and to any toy, finger, or condom being used is the standard. This is where the anatomy lecture pays off. Start smaller and go slower than feels necessary. Fingers before toys, smaller before larger, and long pauses at each stage to let the internal sphincter relax on its own. This isn't a pace you can skip by being more relaxed mentally. It's a physical process that takes actual time, often several minutes of patient, gradual pressure rather than a single push. Any sharp pain is a stop signal, not a push through it signal. Mild pressure, fullness, even some initial discomfort that eases, that's normal. Sharp, stabbing, or worsening pain, stop, withdraw slowly, and reassess. Pain is the body's way of telling you tissue is tearing or at risk of tearing. Positioning matters. Positions that let the receiving partner control the depth and pace of movement, rather than the inserting partner driving all the motion, tend to be safer for beginners, because the receiving partner has the most accurate real-time feedback on what their body is doing. Communicate throughout, not just before. Slower. Wait. That's good. Too much. Ongoing check-ins during the act itself, not just in the planning conversation. And never go from anal to vaginal contact without a change, of condom, of fingers being washed, of toy being cleaned. The rectum carries bacteria that cause significant vaginal and urinary tract infections if transferred directly. This applies to hands, fingers, toys, and penises alike. Clean or swap before any transition. Because rectal tissue tears more easily than other tissue involved in sex, anal sex carries a higher per-encounter risk of STI transmission, including HIV, compared to some other sexual activities. That's a fact, not a scare tactic. And it just means protection strategies matter more here, not less. Condoms remain the most effective single tool for reducing STI transmission during anal sex, for any combination of partners and genders. Use a fresh condom for anal contact, and if you're transitioning to another kind of sex afterward, swap it out. Regular STI testing for both or all partners on a schedule that matches your relationship structure and number of partners is a baseline practice, not an overreaction. PrEP, pre-exposure prophylaxis, is a medication option that significantly reduces the risk of HIV transmission for people who are at ongoing risk. It's worth a conversation with a doctor if this is part of your regular sex life, not just a one-off. And dental dams or condoms for oral anal contact, sometimes called rimming, reduce transmission of a range of bacterial and parasitic infections that are otherwise easy to overlook in these conversations. None of these tools need to be used in combination for every single encounter. But knowing what's available means you and your partner can make an informed choice together, rather than an assumption. Once you're done, a warm shower, gentle cleaning, and paying attention to how your body feels over the next day or two. Mild soreness for a short period is normal. Persistent pain, visible bleeding beyond a small spot, or symptoms of infection, unusual discharge, fever, ongoing sharp pain, are reasons to check in with a doctor. There's no need for embarrassment here. This is a completely normal part of medical care, and clinicians who work in sexual health have heard it all before. Emotionally, checking in with a partner afterward, what worked, what didn't, what to adjust next time, closes the loop and makes the next time easier and safer than this one. The short version: lots of lube, go slow, talk constantly, protect against STIs, and stop at the first sign of real pain. Do those 5 things, and you've covered the large majority of what makes this safe rather than risky. That's the episode. Take care of yourselves and each other.